Hi everyone, I am Dr. Sagar Sahu and welcome to Vet Surgery at Ease. So today I welcome you another case report. Before going to the case report, there is an announcement. I have opened a Telegram channel in the same name, Vet Surgery at Ease. You can search in Telegram and join. There I have shared all the books and notes that I have collected, and also the class notes which I am teaching you also. I have prepared handwritten actually, and I have also shared in that group. Okay, and also if you like the content of this channel, please do subscribe to the channel. There will be a subscribe button down below. Okay, and also you can follow me in Facebook, Instagram and Twitter. Okay, now let us go to our case report. Management of bilateral hind limb actually, limb fracture in a stray dog. I specifically wrote stray dog because it was not actually a pet dog. Okay, it roams freely in the road and only comes to our home for some food and shelter. Okay, that is why I have deliberately written stray dog, because the practice in stray dog is way different than the pet dog. Okay, the management is also difficult in stray dog compared to the pet dog. We'll see the journey how it is difficult. Okay, first on day one, actually the case was presented or I knew about, because let me give some background. The dog name is actually Chongu. Okay, so he actually stays nearby to our home where I stay on rent. My owner, who is my aunt actually gives some food and shelter to the dog. Okay, very nice dog, very docile male dog though, but he is comparatively docile. So I knew on day 2, but what happened actually on day 1? So I heard what happened from some locals, that he was barking at a place. So some person threw a sickle to the dog. So it hit the hind limbs, okay, resulting in the metatarsal fracture in left limb and 2 fractures, okay, of tibia on the right limb. I palpated the fracture to know where the fracture has happened. I don't have any X-ray facility or any kind of diagnostic facility, okay, to know that exactly where the fracture is there. So I am posted in a village area, so we don't have that much liberty or luxury to access the diagnostics. But by physical palpation, it was evident that the left metatarsals were fractured and the right tibia was fractured at 2 points, proximal point and the distal point. Okay, just below the stifle joint and just above the hog joint. Okay, so this was the fracture. Then on the day 2, I actually found the dog quite a bit far from my home, and I brought the dog to my home and I sedated the dog with xylazine and butorphanol. I used xylazine and butorphanol, okay, for sedation. This is sedation protocol. The dose rate is xylazine at the dose is 1 mg per kg body weight, butorphanol 0.1 mg per kg body weight. Okay, so I sedated dog and I plastered the left limb, okay, in which the metatarsal was fractured. Here you can see the principle of says that you should immobilize the joint above and the joint below, but you can see I have made the cast little longer, comparatively more longer. Okay, why? There is a research in Colorado University, actually the Morrison Foundation like that, who conducted this study. What they did, they established or they fit some pressure sensors to see if I am doing exactly the necessary cast or I am simply elongated like that. They were comparing which is much better. Okay, so they found that when you will make the cast a little larger or you can say a little longer, the distribution of pressure is equally distributed among the cast. It results in less pressure source. Okay, sometimes cast puts pressure to cause source, and also it becomes, the fracture segment becomes more stable. Okay, that is why you may enlarge the cast. Okay, you may make the cast little bit longer or little beyond the above joint. Okay, this is the hog joint, I made little above that. Okay, next I did the Thomas splint to the other limb. This was Thomas splint, the right limb, Thomas splint. Okay, I have made a very detailed video regarding the preparation of Thomas splint, how it is help in fracturing, helps in reducing the tibial fracture, mostly tibial. It is not ideal for femur fracture, but it is completely ideal in field condition for the tibial fractures. Thomas splint is very much ideal. Okay, so I did the Thomas splint. This is day 2. Okay, I sedated and I did the POP and the Thomas splint. See, on the day 3 you can see the animal running. Okay, you can say walking nicely. It puts the animal, he puts actually much pressure on the left limb because of the plaster cast, and he puts very less pressure on the right limb. You can see that. Okay, next on day 4 you see the inflammation. Okay, it was also present in day 2, but in the picture I couldn't show you, that is why I am showing this picture. See this inflammation. Okay, see this inflammation. Okay, highly inflamed. You can see here. Okay, highly inflamed. And here is the dog. Okay, you can see the bedding. Okay, my aunt prepared a very nice bedding for him, and also he bought a mosquito net for babies. Okay, so that in the night when you will sleep inside the premises, the mosquito won't bite. Okay, we'll see that whose responsibility is what. Okay, what is the responsibility of veterinarian, what is the responsibility of the owner. Okay, so this is day 4 when you can see the clear cut inflammation. Okay, this is the inflammation and this is the dog. And after in the day 4, just after 2 days, you can see that the animal has the cast or the Thomas splint or the bandage has been dislocated or slided downward. Okay, because you see he is a stray dog. Okay, he need to go out 3 times a day to urinate and defecate. He needs some socialization also. Okay, they won't stay inside the premises like the pet. They are not usual or they are not accustomed to inside premises staying. Okay, now on the day 5 I sedated again because the splint was sliding out or sliding down, so I needed rebandaging. I also sedated with gelazine and butyrophene, same dose rate. Okay, I did the bandaging. Here I used Betrap. This is Betrap. Okay, I didn't use the gauze bandage actually. Betrap is slightly more costly than the gauze bandages, but they are exceptionally better than the gauze bandages. Okay, so if it is also available in Amazon also, if you want to order, you can order in the Amazon. Okay, so and they come in very nice colors which looks catchy. So I did again the bandaging, especially to the right limb, the tibial fracture limb. Okay, so on day 6, see, because they need to go out, they need to socialize, they move a lot, you can see the sliding of the bandages. See the sliding of the bandages, but these Betraps are very excellent. Okay, compared to the gauze bandage, they can stay up to long period, or you can say if in gauze bandage you can maintain up to 2 to 3 days, in Betrap you can manage up to 4 to 5 days, even 6 days. This is Changu, very happy dog actually. In male dogs, male street dogs are usually vicious, but he is comparatively docile. Okay, see, in the day 8 still the Betrap is doing fine here. Okay, compared to the gauze bandages, they do very good. Okay, and see here some bite wounds because of itching by the plaster of Paris cast. Animal may bite that area to cause some wounds. It is all right. Okay, don't need to worry that much. Okay, this is the Betrap bandage. Okay, you can see the sliding down of Betrap bandage because the stray dogs usually will not stay inside home, they need to move. Okay, this is here you saw the sliding down, so I decided that I will go for rebandaging. Okay, after 1 to 2 days. On the day 11 I did the rebandaging, but here one problem was there. I didn't have any anesthetics or sedative agents. The gelazine was exhausted because of some other operations also, and here in the village area finding gelazine distributor is little bit difficult. Okay, so I had to contact some distributor from nearby city. So it was not did not reach in time. Okay, so I did some manual restraint. Okay, so by tying the mouth and tying the limb, I have to do the rebandaging. Okay, so I did the rebandaging, you can see here. Okay, the bed wraps are actually very nice, they look very nice also. Okay, especially to the owner it may look very nice. Okay, so I did the bandaging, but one thing is, see the eyes of this dog. Okay, he is definitely not happy because I did manual restricting. Before these two times when I did the bandaging, I did the sedation. Okay, so animal didn't know. Okay, so here you can clearly see the animal is unhappy, and due to this something happened. The animal or the dog Changu vanished. Okay, vanished from the premises. He went out in the evening, he went out for the urination and he did not come back. Okay, for 5 long days he did not come back. My auntie and myself went out for searching the places where he can go. Okay, near neighbors, we also asked for neighbors, but he did not come. After 5 days, on day 16 he came back. Okay, but he came back with lot of troubles. He looks little bit of diseased. You can see here some dehydration was also there. The most important thing was the Thomas print. See here. Okay, the iron frame which I made. Okay, the galvanized GI iron galvanized iron frame is completely destroyed, and the distal portion, the paw portion, is completely inflamed due to the tightening of the bandages. Okay, when it will sleep, these bandages will come down and it will cause you can say constrictions. Okay, due to the constriction the blood cannot be flow upward, due to which you will find these places inflamed. Okay, when I removed all these things, I found some wounds also. We'll see in the next pictures some wounds here and there because of pressure caused by this frame. If it would have been stayed in place, it might not cause any problem, but due to the slipping of this iron frame, and also the animal was not under the observation of my auntie and also myself, and caused all these problems. Okay, so what we did, I told auntie that we should not go for rebandaging. We simply can't do rebandaging because it is highly inflamed. Okay, so during the time of inflammation you should not do the bandaging because bandage will get loose. Okay, so I told I will keep watch on the animal every day. Let us do not do the bandaging. Okay, I actually thought that if I will not interfere much with the procedure, then animal may stay inside the premises. Okay, so when he will stay inside the premises, I can directly monitor what is happening. Okay, so I decided not to do the rebandaging. This is day 25 after you can say 9 days. Okay, see the wound here. Okay, I was talking about the wound. See the wound. Okay, it was very big when I removed the iron frame. Okay, during day 60, but you can say here the wound. Okay, and the swelling has gone down. But thing is, during these 9 days I observed that the dog was staying inside the premises. Only he will go out for urination or defecation. After that he will simply come to our home and lie down. Okay, so I thought that I decided actually I will not do the Thomas printing to this limb. I focused more on this limb, which I was sure or I was guaranteed that the limb will completely heal. Okay, and I can give the animal a life with 3 legs, which is completely fine for a stray dog. Okay, one more thing here, you can see some inflammation. Okay, between this digit. To prevent this, you have to, if you are doing this, to prevent this you have to add some povidone iodine powder regularly. Okay, povidone iodine powder, it is available in the market. This will prevent the bacterial infection, especially the pyoderma. Okay, if you are not doing this dusting, or you can say adding the powder between the interdigital space, due to the accumulation of moisture, bacteria growth will be enhanced, or you can say exponential growth of bacteria, which will cause the pyoderma. So you have to add some povidone iodine powder regularly to here also and to here, this side. Okay, so that there will not be accumulation of moisture. Whatever moisture is produced, it can be absorbed by this povidone iodine powder, and povidone iodine powder is also antiseptic. Okay, due to antiseptic in nature, it will prevent the growth of bacteria. Okay, so next on day 28, which completed 4 weeks, so as I was observing day by day, so I saw that the animal is bearing weight on the left limb very nicely. Okay, so I decided to remove the plaster cast, see how much of sand the animal has accumulated inside the cast. Okay, sand and dust, some plant leaves also inside that plaster cast. Okay, this is why it is very difficult in case of stray animal to manage such things. Okay, in case of pet animal, you can keep the animal inside the room, they will stay nicely, or even if some they are aggressive, which can easily be managed by owner. But in case of stray dogs, it is very difficult to manage. Once they are outside, you can't predict things. Okay, what they will do through the cast, what they will do the splints. Okay, so it's all right, but you can at least monitor. Okay, here actually the advantage was I was staying inside the premises, so I was able to monitor on a daily basis. But if you are an owner, then it is a bit difficult, but it's not impossible. Okay, so I removed the plaster cast. Okay, you can see some minor wounds. When you will be doing the POP cast and the animal is moving like that, you may find some wounds. Here is a small wound, and also here is small wound. Okay, but these wounds are not major wounds. If you will manage even with topical medication, they will heal very nicely. Okay, and see here the wound has been completely healed. In case the right limb, which I was showing the photograph in day 16. Okay, you can see the wound has been healed. I will discuss what are the treatments also we opted. And on day 29, see the animal walking. Okay, in 3 limbs the animal is walking very finely. He is very happy also. He can go out, he can mingle with her best buddies also. Okay, and on day 60, I was still observing day by day. I was little bit worried it should not become compound, and I was also sure that it will not become compound because it was mostly transverse fracture. Okay, when I was palpating, I didn't found any pointy structures. Okay, due to the transverse nature, it is less likely to become the compound fracture. Okay, in that case, it might be another story, and it might have been much difficult to manage. It was simple, that is very easy to manage. On day 60, you can see the animal was slightly bearing weight on the affected limb, especially the right limb, which was severely affected. Okay, you can see the limb is slightly bent. Okay, slightly bent. The hock is slightly ventral. Okay, why I will discuss also. But still the animal was able to bear some weight. Okay, on day 90, after 3 months, you can say the animal was walking with that limb. Okay, though it is still not bearing the full weight. Okay, but he is able to live his life in the wild, exactly not wild, in the road also, and he was also marking the territory. Okay, see how the healing was there, even if the Thomas splint was not there full time. Okay, so there are many types of healing. Okay, but the thing is, when the fracture segments are not completely opposed, or you can say there is movement between the fracture fragments, then the healing type is indirect healing. Okay, this is indirect healing. Indirect bole healing occurs in fractures stabilized with a cast, or if you are not also stabilizing with cast, then also it will heal with the indirect healing. The problem with indirect healing is the callus. This is the fracture here. You can see this is fracture. This is not the fracture of Chongu. Okay, this is not the fracture of dog. This is some example. See the callus. Okay, the callus is very thick. You will, if you will see the movement between the fracture segment, the callus will be very thick. Okay, the different techniques, that internal mobilization, especially the pinning or the plating like that, they are designed to prevent this movement and to prevent the gap between these fragments. When there will be minimal gap, there will be minimal callus formation, and thing is, when there will be minimal callus formation, it will take less time for the bone remodeling, and also the function can be restored easily. Okay, so in indirect healing, which is the case of Chongu, okay, you will find very thick callus. I also palpated those callus. Thing is, the callus, when they will get remodeled, it will take very long time. Okay, you may not count in months, it may take like you may not count in days, actually it may take months. Okay, after 90 days, 3 months, he was able to at least bear some weight. Okay, but it's all right. You see, if you see from stray dog point of view, you are giving at least life. He can live lively happily. Okay, but it will take much more time to heal, but it's all right. Okay, and the problem with this healing is some malformation or malunions. Okay, the animal's limb might get bent towards the lateral side and medial side, or towards the anterior side or the posterior side. Okay, the valgus and varus, when it is rotated, or you can say displaced to lateral and the medial side, anticurvatum and recurvatum, when they are more towards the anterior and posterior, bending of the limbs, or torsional, when it is bent towards through its axis, transitional, okay, shifting of the bone. Okay, so it may, all of this, most probably what I thought of that is that it has been, the bone or the healing has been towards to the posterior side, or you can say the fragment or distal fragment has been slightly pushed or slightly healed slightly towards the posterior side, due to which the hock is slightly, the ventral, you can say hock was slightly towards the ground. Okay, what I palpated. But if I would have been some diagnostic things in my place, like X-ray, at least X-ray, I am not talking about any of the like computer tomography or like that, at least X-ray, then I could have known the exact things that has happened. But from palpation, what I got, I am sharing with you. Okay, I may not be 100% right, but at least what I saw or what I felt, I am sharing with you. One more thing that is I wanted to highlight with this case report is the responsibilities. Okay, so during this journey, if you are veterinarian, you know that the ideal treatment, or you can say the theoretical treatment, could be plating or pinning like that, some internal immobilization and also some external coaptation bandage. Okay, it may be, but thing is, it may not be available with you. So some so-called activists or so-called animal lovers, they will come and talk about the ethical treatment, or you can say ideal treatment or theoretical treatment. But the thing is, suppose if you are doing pinning or plating, the post-operative care is much more, or you can say it will be increased tenfold when it is not done, especially in case with respect to stray dogs. Okay, so thing is, everyone should know their responsibility. Okay, first is, what is the responsibility of the veterinarian? The first and foremost responsibility is treatment on the day it is presented. If the case, when the case is presented, to treat the animal, it is the responsibility of a veterinarian. But it does not mean, suppose the animal's limb is highly swollen, so maybe the veterinarian may not bandage on the same day. She might prescribe some medicine to reduce the swelling, then he may do the bandaging on the second day or third day. But it is the discretion of the veterinarian when he wants to do the, or how he wants to, or he or she wants to do the procedure. One more thing, after doing the procedure, the owner might call you regarding the post-op care. Okay, sometimes he or she may get confused regarding the post-op care. When he or she, the owner specially calls, the veterinarian should pick up calls and give some advice. Okay, if he or she cannot pick up because of busy time, he or me say call back, or if the animal owner call backs after in his or free time, then he should pick up the call. And also when the animal owner will present the animal for follow-up treatment, okay, the veterinarian should attend, veterinarian should see what is the progress, and he should convey those messages to the owner regarding the progress of things, and also he can give the advice regarding the procedure or the future course of action. But thing is, most of their measure of the responsibilities lies with the owner. Okay, it is always the owner who has the maximum responsibility. Okay, surgery, if you will see the surgery, if a surgeon is doing surgery, he is only doing 50% or 60% work. Rest 40% or 50% work is with the owner, because the animal will stay with owner. The owner will take the post operative care. It's not the veterinarian who will go to his or home daily to do the post operative care. It is the responsibility of owner who will do the post operative care on the advice or the under the guidance of the veterinarian. Okay, so first thing is he should present the animal on time. Okay, because the fracture has happened today. If in this case I found the animal on the second day, it's all right. Sometimes the owner may take and bring the animal after third day, fourth day, or sometimes the animal bring the animal after the fracture has been turned to compound fracture. Okay, that is not right. Okay, they should know their responsibility. If they want the treatment on the day when they are noticing things, they should bring into the notice of a veterinarian. Following the post of advice of doctor, whatever the doctor has said, suppose there is some wound, the doctor has done stitching, and the owner has the veterinarian has advised that you should keep it bandaged, you should keep the animal from biting the suture line or the scratching the suture line, then it is the responsibility of the owner. He should follow this. Okay, he or she should not give excuse that if the animal is scratching, what I will do. Okay, that is not the thing they have to do. They know their animal better. If it is a pet dog, then it's all right. Sometimes they know. If he or she is handling the stray dog, then he can take some advice from the veterinarian how to deal with them, but it is their responsibility that they should do that. It is not the responsibility of veterinarian. Next, taking the animal to the veterinary hospital time to time. Okay, so many a times, especially in fracture cases, the owner, the veterinarian will tell the owner that you should bring after each 3 days for rebandaging. Okay, so the owner, it is the responsibility of owner to bring the animal to the veterinary hospital after each 3 days. Okay, or 4 days, whatever the veterinarian has advised. Okay, if he or she due to his or her work, he or she will delay up to 6 or 7 days, that might be some complications. Okay, so it is the responsibility of the owner or the representative who is bringing the dog. This is also the giving the medication in proper doses. In these cases, I have not discussed the medicines. Here I am discussing. You see, importance of medicine is very, very crucial. Okay, see, in this case, for first 5 days, I gave antibiotic tablets, cefodoxime. I prescribed, actually I did not give, cefodoxime and meloxicam tablets. Okay, my auntie, he dissolved, the Chongu loved milk and chicken. Okay, so he gave the cefodoxime and melonex tablets. Melobest tablets, the brand name is Melobest. So Melobest tablets were given for first 5 days and the cefodoxime was given for 7 days. But I prescribed for this period. But auntie gave the antibiotic and painkiller both for 4 days. After 4 days, Chongu, during the first 4 days, Chongu was in severe pain. So he did not discriminate between the foods. Okay, or maybe his sensory or the nasal sensory were not that much of importance. He was very hungry and he was taking the food along with medication. After 4 days, the animal tried to, when the inflammation gone down and the pain gone down, he did not take those medicine. But at least auntie tried every day. Some amount of medicine was going from his food. Okay, so it is the dedication of the owner which makes things happening. Okay, especially when the the veterinarian has prescribed some medicines. It is very important that you should give some medicines in proper time. Okay, Also, when I told you about the wounds, when on day 16, when I removed the iron frame, the damaged iron frame, there were some wounds. That time also I prescribed some cefodoxime, and auntie managed to give this cefodoxime for 5 days. Okay, how she gives, it is up to her. Okay, first he tried with milk, but when animal did not take, he tried with chicken, which was completely easy. After 1 to 2 days, animal identified that, then he resorted into some other options. Okay, but she gave, okay, she gave the medications. That is why there was some success. Okay, so it is the responsibility of owner who should give some proper dosage of the medicine which veterinarian has prescribed. If the animal isn't taking, he may consult some veterinarian to get some ideas. Okay, but there is no alternative that you should not give the medications. Okay. Next, give adequate nutritious food. The apart from medicine, actually it is not medicine. The most important thing in this case report was food. Auntie gave very good amount or nutritious milk chicken which the animal loved, which Changu loved. Okay, the animal ate very nicely, very peacefully, very calmly. When you take your food very nicely, you know you heal better. Okay, so it is the responsibility of the owner, okay, to give some good amount of food. The food is very important. It contains all the minerals, okay, all the nutrients that needed for the healing, whether it is bone healing or you can say tissue healing, okay, soft tissue healing. Next, regular checking of the animal. It is also the responsibility of the owner. He should check the animal regularly. Suppose many a times veterinarian will tell, I am doing the bandaging. If you find some foul smell or you will find some the bandage has been wet, then bring the animal to the veterinary hospital. So the animal owner should check properly. Okay. Sometimes the animal may urinate and which may get seepage into the bandage. Then the animal owner should notice that thing first. Then he or she should bring the animal into the veterinary hospital. It is the responsibility of the owner. Last is play with them. It is also very essential because animal do get depressed. Okay, so during time of disease, you see in social media you will find especially on Instagrams or Twitters, you will find very good photos and videos with their pets. Those photos and videos are basically when they are happy. Okay, the dog is happy. Many times you may not find true journey, okay, of patients, or you can say dogs or cats, those who are diseased, those who have some fractures. Those periods are actually very difficult. Your dog may get depressed. Those no one will show you. Okay, sometimes the owner, I have seen many owners who don't take care of the animal when they are diseased. Okay, so be empathetic. If you are not at least empathetic, be sympathetic at least. Okay, so you need to play with them. Whenever I return from my office, I will see Changu, I will do the belly rub and I will massage the ears and necks like that. Animal will get happy. When auntie will see Changu, he will give some massages and also he will play with him. So she will play with him. Sorry for he or she confusion. So she will play with the dog. It motivates the dog. Okay, if dog is happy, you see when the dog is happy, he will not do any damage to the wounds. Okay, if some problem is there, he is not all right, or he is depressed, or you can say he is irritated. Okay, the animal is irritated, he or she might damage things. Okay, so be empathetic. If you are not empathetic, at least be sympathetic. Okay, so this actually I want to highlight that what is the responsibility. Okay, so in this case report we saw how the journey was really difficult. Okay, because we did not, especially it was the responsibility of mine, I did not follow the ideal mechanism or the theoretical treatment which can be given. I gave my best which is available in my area, which is available. The bacteria was also not available, I brought from Amazon. Okay, after that I did the bandaging. It arrived 1 to 2 days late also. Okay, so whatever I did at my best. So I am sharing this case report. It may not be a very successful case report or ideal case report which can be shared in different journals, but this is a field case report. The series also I filled case reports. Okay, the thing is, you see, sometimes giving a life, or you can say which in which life he can at least play and he can at least mingle with his buddies, is a happy feeling. Okay, this world is actually full of pain, or you can say this is world of pain. As a doctor, you have got the capabilities, or you have got the blessings of the Lord, that at least you can lessen the pain. Okay, so please definitely do that. Okay, so I hope you will do all those things. So I will meet in your next class, next case report, whatever it may be. Till then, tata, bye bye, take care.